Okay, welcome to exercises for arthritis, joint specific. We're going to go with the lower limb today. Next session will be for the spine and the upper limb. So just a very quick disclaimer, as we have for all presentations here, that this contains general information. Every effort has been made to ensure the information is accurate and reliable. It is not a substitute for individual treatment advice from your doctor or health professional, though I do say take this information to them and ask if it's appropriate for you. So always consulting with your doctor and healthcare provider to obtain individual medical and treatment advice. Okay, so here's the outline for today. We're going to very briefly recap why physical activity and movement is important for people with arthritis, okay? Very briefly, because we've touched on this multiple times in other presentations, but it's always good to start off remembering this, acknowledging this, and taking it forward with us. Then what I'm going to do is I've pulled not all, but most exercises from Get Moving Plus from the lower limb exercises, hip, knee, and ankle. I've also included some exercises that may not be in that resource, particularly for the ankle, for the toes. As we go through each of those joints, I'm only going to very briefly talk over the anatomy of the joint and the function. Again, you may not necessarily need to know this, but I think it actually helps you understand the reason for the movements that have been included. And then we're going to have a look at exercises that promote mobility, joint mobility, and some stretches and a few strength training or strength exercises for that particular, excuse me, joint, or say the muscles around that joint. Now, as we go through these, each section, what I might do is show them on the slide. Then I'll have to stop the share and then I can sort of step back and show you or go through these with you. The hip and the knee you will have seen a lot of times, I feel, but the exercises for the ankle or the toe and the feet, that one I think a lot of people may not have seen, and we'll certainly go through those, and I'll bring it off the PowerPoint presentation. So let's get started. Actually, what would be interesting to note, if you'd like to share, in the chat box, would you like to just write what joint you need most help with? So is it around the hip joint, is it around the knee joint, or is it around the ankle joint, or 2 or 3, or all of the above? So just write hip, knee, ankle, or all, and that also gives me an idea as to what we're doing. All, hip, knee, yeah, okay. Hands, yeah, okay. I think we've got a fairly even spread. Okay, thank you. Thanks for sharing, everyone. Okay. All right, so let's remember the importance of exercises for joints. Now, I've limited the benefits just to the joint itself, because there are many benefits to exercise, you know, from our mental health to our cardiovascular health, more systemic, but I'm just focusing on the joint. We need to remember that movement nourishes our cartilage and our bone, okay? Particularly weight bearing and loading movements. So for example, just walking, but then very much planned exercises like an exercise class, or things like squats and lunges, and other type of exercise that you might do in a gym, like stationary or seated machine exercises. So it's really important to load the joints, because your cartilage is like a sponge, and it literally soaks up the synovial fluid, the water within the joint, and the movement, the compression of loading the joint actually squeezes out the synovial fluid. So the cartilage soaks it up through movement, of course, and then more so movement and the compression squeezes out the synovial fluid. And this is how cartilage and the bone there stays healthy. So if we're not getting movement because we're sedentary, and or because we have structurally we're limited because we may have had changes due to our arthritis. What cartilage we have there isn't being nourished. So it's so important to move with whatever capacity, with whatever range we have, and do it often. And speaking of mobility and moving, exercises obviously maintains joint range and joint flexibility as much as we can with the limitations that we may have. Excuse me. Obviously, it maintains strength of the muscles, and that's very important, particularly as we age. Typically speaking, as we age, there will be a certain amount of loss of bone density and muscle mass and strength. That's normal. But what we want to do is reduce that amount. So if we're adding load to our muscles and to our bones, that keeps them nice and strong and therefore helps prevent falls, for example. And particularly keeping the muscles strong help provide stability to a joint that might be affected by arthritis. Because movement helps move synovial fluid around a joint, it helps therefore reduce the stiffness and the pain feeling that we may have in our joints. And of course, it can help reduce and slow the progression of the disease itself. Okay, so very, very quickly, let's have a little look here at the hip joint. Okay, so the hip joint is what we call a ball and socket joint. So typically there's a ball here, not particularly like a tennis ball all the way around, but fairly round, and it sits into its own little socket, as you can see here. And it's what we call a multi-axial joint, which means it can move on multiple planes. So the ball just rolls around in the socket and provides a whole lot of movement for us, particularly of that lower limb. It allows us to move, to walk, to run. So it provides flexion and extension, so the leg going forward and back. It provides rotation, so moving the knee or the foot to turn in or to turn out. And it also provides, excuse me, what we call abduction and adduction. So taking the leg away from the body and bringing the leg closer to the body. In the chat box, could you please tell me just some typical movements or activities that you might do during a day that needs hip mobility? What would that be? I've already mentioned a few really simple ones like walking. What do you do during the day where you really need your hip mobility? Stairs, thank you, stairs. What about cleaning, getting in and out of the car? Perfect. A sit to stand, so getting in and out of a chair or a toilet. Walking, bending, swimming to exercise. Absolutely. So it is imperative that we maintain the movement of this joint, this multi-axial joint. Whatever range we have, whether it be flexion and extension, rotation, abduction, adduction, whatever range we have, we want to keep. So in osteoarthritis of the hip, the entire joint structure can be affected. Joint capsule, so this white inert tissue around the outside. We've got some ligaments here, but we've also got a joint capsule around the outside that encapsulates everything, like the synovial fluid, for example. That can either shorten or lengthen when it shouldn't, and it creates limitations of ranges of motion. The disease can progress whereby we get and we grow what we call osteophytes or spurs, so bone growths, sitting out here or here or here. And that actually, again, limits movement or mobility. So our function is governed by our structure. So if our structure is impaired, therefore our function is also, which is why it's so important to, with whatever motion we have, we need to maintain it. Of course, we have other changes as well. So we can get scarring of the capsule, but also of the tissue surrounding it, including the tendons and the muscles, depending on the type of arthritis you have. So if you have OA, mainly it's bony changes and cartilage changes. But if you have like a rheumatoid arthritis or other autoimmune condition, not only will you have the bony and the cartilage changes, you'll also have the soft tissue changes as well. So that affects our muscles, tendons, and ligaments. So the muscles that we want to focus on in terms of strengthening, we have the quadricep muscles. So all these big muscles at the front, which help bend at the hip. We have hip flexor muscles that do the same. We also have adductor muscles on the inside of our leg, which bring our leg towards the midline. We have our gluteus maximus muscle. We also have glute med and min. So these are really important muscles for stabilizing during those stairs that you mentioned, during bending, any sort of activity where we're using one leg, for example, balancing, for example. And so these stabilizing muscles are the ones that need a lot of work, because often the glute max, for example, the larger muscles tend to take over, and we lose the ability or the strength of the smaller muscles here. We also have hamstring muscles. So the exercises coming up now are going to focus on moving the hip joint, as we saw, and then strengthening these muscles here. Okay, so the first ones we have is a hip flexion in lying. So I've also created these exercises whereby trying to cater for people who are not as mobile or not as fit. And then, of course, there are exercises in the Get Moving, which is a different resource, that are for those people who are a little bit more fit, a little bit more mobile. But doing a lying hip flexion like this, just bringing your knee towards your chest, helps to encourage movement into flexion. Often, flexion and internal rotation, so moving the leg or the thigh inwards, are 2 of the 6, or all ranges of motion can be affected of the hip, but are they often the most common actions that are affected with hip arthritis. Now, if we want to stretch out the front of the joint capsule, okay, then we can also do a lunging position. We can do this off the ground or on the ground. And then with this 90-degree angle made at our knees, we can lean forward and we stretch out this front part of the hip. So this stretches the capsule or the joint, but it also stretches those hip flexor muscles that I mentioned before. And here we have a typical standing quadricep stretch, which is also very important to ensure that we elongate those quadricep muscles so they can function to their best ability. For more rotational mobility movements, here we have a lying internal-external rotation exercise. So all you want to do is be lying on your stomach and create a 90-degree angle at your knee. And then all you're going to do is slowly, like a, what's this? Whatever those are, a metronome almost. You want to, like a rudder, should I say? And then you just want to drop your foot sideways, going through the internal external rotation movements. Okay, so this helps maintain that particular internal external rotation mobility. Now, if you have a little bit more flexibility, you can turn over on your back, place your ankle on top of your knee, and gently push away this top knee, and again to help open out and provide external rotation for the hip. A further stretch can be done if you pull the thigh towards your chest. You will also get a stretch of the glute max on that left-hand side. If you can't do this, you might like to try, a seated position. This is the same position here, as you can see, but I'm in a seated position, and stabilizing with your hand and ankle on your knee, other hand on your opposite knee. See how it's starting up? We want to place some pressure down. Now, you can either hold for 2 seconds, 5 seconds, this particular stretch of muscles and capsule, or you can gently move in and out of a range 10 times, and you might like to do that for 3 sets. Now, what you don't want to do is probably push into a range of motion that causes extreme pain, but a little bit of discomfort is okay. So we're sore but safe, okay? Here we have some stretches that you may like to try. So here I'm seated on the ground with my legs straight, but you can also be in this position here, but just bringing the knee towards your chest. Here I'm going to pull my knee across my body and I get a nice glute max stretch and glute med, so those gluteal muscles. Here we have a standing sideways lunge, which will stretch my adductors. Here I have a hamstring stretch, which I can use. If I can't reach my foot or reach my leg to pull it towards my chest, I can use a towel, for example, and gently pull my leg towards my chest. If I can't get down to the ground, well, I can use a step. So I want to place one foot up on the step and I want to gently lean forward over my knee. And if you push your bottom back and then lean forward over your knee, you'll get a stretch again in that hamstring area. Now, if you'd like to strengthen your glute muscles, so that when you're doing, for example, when you're walking or walking upstairs, there's moments in time in that gait when you're walking and you're running where you're moving from only one leg. So you've got one leg in contact with the ground, and then you'll have two legs in contact with the ground. But at some point in time during that walking gait or that stair gait, you'll only have the one leg on the ground. And so we want to ensure that we maintain strength within those glute muscles to provide stability going up and down those stairs. So here you have me lying down on the ground. If I can get there, you can also do this on a bed or a couch, similar to the one behind me at a nice low height. I can do a straight leg abduction. So I want to make sure that I'm stable on the ground here and I'm comfortable by bending my leg and I'm supporting my head with my hand. And all I'm doing is lifting my ankle to the roof, okay? I can keep it in line with my hip, or I can take, excuse me, or I can take my ankle slightly backwards as well. If you want to reduce the lever of that leg because that might be too difficult, then you can bend your knee. Keeping your ankles together, we can do what's called a clam exercise. So side lying clam, and we want to take the knees from a starting together position to the knees apart, and we're really targeting again those gluteal muscles in here. How many times might you like to do this? Well, it depends on where you're starting, but typically we're at a rep range of, so how many times you might do an exercise of anywhere between 8 repetitions up to 12 or 15. And then how many times would you like to repeat this? Again, that's up to you, anywhere between 2 to 4 times. And here we've got some more strength. So this glute bridge is a fantastic exercise for, again, strengthening your glutes. This is from a lying supine position on the ground, stabilizing through and pushing down through my ankles. I want to lift my hips towards the ceiling. Squeezing the glutes as you get to the top and then lowering slowly with a controlled motion. Here we have a stalk stand, and what you can do is stand nice and tall next to a wall with your leg closest to the wall touching just slightly. And what this exercise does is, again, mimics motions like walking up and down stairs, like walking, for example, where there's one foot or one leg in contact with the ground. And what you want to do is ensure that that hip doesn't sway out to the side. And this is where we can actually squeeze those glutes on nice and tight, and we can maintain that. So it's also a balance activity, but also a strengthening activity as well. And if you want to, excuse me, try some balance exercises, this Y balance, it's actually a test, but you can use it as an exercise. This is really good for balancing, again, on that one leg. Now, here's me doing it, but without any like a chair or a rail to hold on to. If you're a beginner and your balance is quite affected because of your knee, your ankle, or your hip, or for whatever other reason, I would suggest doing this with a chair in front of you. That what you can do is progress by slowly taking your grip, or how much you use it, away from the chair until you're doing it without a chair or without a rail. Other strengthening exercises are, for example, a sit to stand, lunges, and step ups, all of which you've probably seen and heard before. Okay, so so those are those exercises there. We've probably seen or heard a lot of those ones before. What I feel would be most beneficial if we do the knee and then have a look at the ankle, and we can have a look at doing some of the movements of the foot and the toe together. Just looking at the time here, I want to ensure that we do that, because they sometimes can be the most tricky. Remember that this session is recorded, so you can always come back and pause and have a go at these. But this resource is also available free with videos on our website. Okay, so let's have a look at the knee. Okay, so like the hip, we'll have a quick look at the anatomy and then move towards the exercises. So here's your knee joint. We have the femur and the tibia coming together to form the actual knee joint itself, with the patella on top forming another joint that helps aid in movement. This is a synovial hinge joint. It only really moves in one plane, hence why it's got a hinge joint, though it does have some rotational aspects in terms of when we're moving in a walking capacity, when we're extending our leg, for example. There is a slight rotation there, but we're mainly focusing on flexion and extension here. So flexion is where we're bending the knee, so the ankle goes towards the bottom, and from that position there is where we take our foot all the way through forwards, where our leg is then straight. That's the extension movement. So once again, very similar to the hip, you would have been mentioning, for hip mobility or exercises or activities that I do that require hip mobility, for example, the walking, stairs, getting in and out of a car, sitting and standing, you need your hip mobility. For all of those activities, you need knee mobility as well. So again, very important. Here we have the thigh muscles. So the muscles that we're going to look at in terms of strengthening are going to be looking at the quadriceps muscles that sit at the front and the hamstring muscles that sit at the back. They cross over the knee joint and allow forward movement and backward movement, which is our flexion. So hamstrings creates flexion, and our quadriceps, or rectus femoris in particular, creates the extension movement. So the movement of the tibia going forward. So again, depending on where your fitness status is, depending on whether you're quite sedentary and you are limited by your mobility, here's me lying down and creating a sort of passive knee flexion. And all I'm going to do is to create movement. And this is, I'm not loaded here, so I'm not standing, but any movement is good movement, particularly if you're not getting a lot or any. So all this one is taking my heel. I'm going to slide my heel towards my buttocks. Okay. And if I can't do that well, I can always use a towel and scoop that around the front of my ankle and draw it towards my buttocks. Okay. Here we have a knee extension. So what I'm doing is trying to mimic that end range extension that we need when we're walking. So that's very important that we get that full extension of the knee when we're walking. And if not, it really limits it changes our gait. So the way that we walk, it limits our stride length. So that the length between one foot and the other, or the distance between those. And if we're kind of that might lead us to a little bit of shuffling, for example, and it could then lead us or increase the risk of falls. So here we want terminal range extension. So what I'm doing here is I've got a roll up towel under my ankle. With my knee, I'm going to push it into the table. As I do that, I'm going to contract my quadriceps here, okay? So that's me actively doing it. Passively, I can sit on a chair. I can have my knee bent, have my arms or hands above my knee, and gently take my knee into extension. Okay, so I'm gently pushing my knee into the ground. Again, we're working within our comfort range. So we don't want excruciating pain. We don't want 7, 8 out of 10 when we go into these movements. But we're still safe, even if it's a little bit sore or uncomfortable, but we don't want 7, 8, 9 out of 10s. Okay. Now it's really important that we maintain flexibility. So we've seen a quad stretch before, but a calf stretch. So the muscles at the back of the lower leg here. We want to ensure that we're pushing against the wall here and ensuring that the ankle stays on the ground. So we're stretching this back part here, which allows full motion of the ankle, but also of the knee. But again, all our joints here and the muscles that cross over, they're very much interrelated and connected. Now, here's some more knee extension depending on where you're at. So if you're quite immobile, you are pre or post rehab, this is a great exercise for you, particularly if you have minimal knee range of motion for whatever reason, whether it be arthritis or a surgery or any other issue going on with your knee. We want to, again, encourage extension of the leg. So we want to push down into the towel and lift our ankle off the ground, which might even give us a little bit of hyperextension. Here we have terminal end range extension again, but banded with resistance. Again, really, really important to ensure that we do get this straightening of the knee as we're walking, so we have full range and we reduce risk of falls. In terms of strengthening, here's me sitting down doing end of range quads. So it's just an extension of the leg, but we're working the quadriceps. And the reason why this is so quadricep focused is because as we age, we often lose a lot of power in the quadricep muscles. And they're so important for everything, for movement. But it's important to maintain that power because we need power to get up out of a chair, up out of bed, and out of a car, for example, getting up and down stairs. So it's important to maintain that strength, but also, I guess, power within that muscle. So if you're not at that stage to add resistance, then you can do it without resistance and ensure that you squeeze quads. Here's me laying on my stomach and I want to work my hamstring muscles at the back. So I'm going to bring my heel towards my bottom and I'm going to add a TheraBand to add some resistance. And I can bring my heel towards my bottom and I can do that 10 times, 15 times, and I might repeat that set 2 or 3 times. Last but not least, and so we can I'll turn off the screen after I finish this and we can go through some of these exercises. So this is the ankle anatomy and the function. Now the foot, very much like the hand, is very complex, a lot of moving muscles and a lot of moving joints and bones. So I'm not going into this one, and even just looking at it looks intense, but it's a very complex synovial hinge joint. And this is a typical ankle joint here. It's made up of 3 bones, tibia, fibula, and the talus. Okay. The ankle joint is actually called, a funny word, the talocrural joint. It provides dorsiflexion and plantarflexion, so it moves up and down. So I've got these movements here for us. It also performs inversion and eversion. So looking under our foot, it does this movement here. There is also a slight adduction and abduction as well. And all of these movements are so necessary for when we're moving, walking, running. The reason why there are so many joints and bones, and the reason why it allows so many more movements than, say, a knee, is because it needs to adapt to the surface in which on which we're contacting. And so lots of small movements need to occur. And so that if arthritis is settling in some of those joints, and more often than not, arthritis affects more these metatarsal and phalangeal joints down here, not necessarily up here, but they often affect these here, which reduces our ability to adapt to the ground. And again, increases our risk of falls. And we want to reduce the risk of falls. So here's a really good starter test to see if you've got some mobility in your ankle. Again, really important for when we're walking. We need ankle dorsiflexion, which is this motion here. So taking my toes towards my tibia here. You can do a knee to wall test or exercise. You should be out, see this ruler here? Getting my knee to the wall and keeping my ankle or my heel on the ground, I should have anywhere between 10 to 12 centimeters. So that's an easy activity that you can do. Grabbing a ruler, putting it up against the wall, on the floor against the wall. And what you're going to do is you're going to shuffle your toe backwards while testing your range of motion, getting your knee to the wall by keeping your ankle on the floor. And you want to see what range you have, okay? So what you want to aim for is 10 to 12 centimeters. Here is an example of what it shouldn't look like. I can't get my knee to the wall, and to get it there, they'll have to lift my my heel off the floor, and that's what we don't want. You can use it as a test, but you can also move in and out of this range and do it as an exercise. If you want to help improve the dorsiflexion or the movement of your ankle, which may not necessarily be affected by arthritis, but because you may be more immobile or more sedentary, you're not moving that joint as much, and therefore you may be reducing the mobility of it. So even if there's no arthritis there, you might want to practice these exercises to maintain what movement you do have there. And if you're able to get down in this position, this crouching position here, this is a active or passive or active assisted exercise where I'm going to bend forward over my foot here, and at the same time try to hold my calcaneus or my heel bone to the ground. And this here creates a bit of a lever, if you will, to bend over. So what we're trying to do is create and enforce the biomechanics of that ankle joint. So we can, again, increase or maintain the dorsiflexion or the flexion of the ankle. Some other ones that you might like to try doing is calf raises on the floor and off a box as well, so you can increase the range. Excuse me. And for mobility exercises, you might like to do the ankle alphabet or your ankle name, for example. So here you can just pop a rolled up or a bolster underneath your knee. You can just do it seated with your legs dangling, or lying. It is totally fine. Anything works. And to create mobility of that ankle joint, because it moves in so many different ways, write the alphabet. So, you know, pretending you're holding a pen with your toes, you can write the alphabet or your name. So that's also quite helpful as well. Okay, so toes is what we're going to is what we're going to have a little look at here. And after I go through this one, I'll take us off the screen and we can go through some of the exercises if you'd like to give them a go. Now, toes and feet can be significantly affected by arthritis, particularly rheumatoid arthritis. All of these changes can occur for multiple different reasons. You can get a bunion, as you can see here, but it may not necessarily be because of an arthritis, for example. And rheumatoid arthritis and osteoarthritis can cause very similar deformities of the toes and the feet in general. But often we see bunions. So we're getting this deviation here of the big toe. Okay. Oops, sorry. And often that comes with, particularly if it's arthritis, often this comes with some swelling and thickening and scarring of the tissues and the bone around it. Can be very painful, and you lose mobility of that big toe, again, which is very important for when we're walking and that toe off stage. We definitely need movement of the big toe just to walk. You wouldn't think so, but that one little big toe, and if you have toe issues, big toe issues, you'll know what I'm talking about. You need that big toe mobility to walk. And over here, we might have what we call a hammer toe. So we have this middle knuckle here starting to be bent. And this is because some muscles here and tendons can become tight and they pull, but also the joint here can be affected by arthritis, okay? This can displace toes. We can get crossing over of toes where toes sit crossing over each other. And again, that can inform the development of bunions, for example, and other calluses and ulcers. So not very nice at all. And when you've got really sore feet and toes, you don't want to walk because it hurts. So here are some on x-ray, some things that can happen so you understand the severity. That can happen, and why it's important with whatever stage you're at now to maintain what mobility you have. Whatever structure you have. So here's a normal foot with no disease, if you will. But here's a foot that may have rheumatoid arthritis. You can see the bunion occurring here. You can see how this end bone here has been enlarged. And we can see that we've got these hammer toes occurring here where the joints are being displaced. And we've got a crossing over of the toe here as well. And you can see this whiter shaded area. That's probably the actual soft tissue skin. So we're probably sitting up like this. And then the toes are sitting like this with some crossing over. Also, deformities can occur, particularly over a long period of time, which doesn't go well if you have arthritis as well, because of our shoes. Shoes over time change. Our feet are so, they adapt. They're so adaptable that they change to their environment. So if you've been sticking your feet in very narrow shoes, so they have a very narrow toe box, what we call here, over time, this big toe, this hallux, which we call it's the big toe, a valgus movement, or this movement where it starts to cross the other toes starts to occur. You add arthritis into that big toe, you've got a big problem. What we need to do is actually perhaps find some shoes where our toe box is wider. See how our feet now can spread out and we don't get the deformity that we may get here. So this is something that can happen over actually not a longer period of time as you may think, even just a couple of months, but yeah, you compound that by years and arthritis, and it's not and it might end up looking something like this. So what do we do about that big toe? Now, again, if you're in a flare-up stage and you've got a really sore toe because it's the arthritis, it's swelling, it's causing pressure, it's flaring up, then I suggest that you don't do the exercises. Wait till a period of time where that pain and inflammation has gone down. But for anybody at any stage, these exercises are fantastic. Give them a crack. So the first one we just have generally standing, and we're going to generally just lift the toes off the ground, toes and big toes. Okay. The next one B, we're going to try and spread all our toes out. And the last one here is this acts as a stretch, but also for strengthening of the intrinsic muscles as well as the calf muscles. But we're going to do heel raises. This helps a stretch here, okay, provides movement here, a dorsiflexion action here, and it also provides a stretch and also a strengthening exercises depending on which muscles we're looking at. Over here, what you might like to get is a ruler or put some tape on the ground, and you want to place your foot next to it like this, okay? And your big toe might be leaning away from this ruler. My big toe right now is my pinky. And what you want to do, as in the picture there, you want to bring that big toe towards the ruler to line up with the ruler so it sits straight. That's a very difficult exercise to do while keeping the rest of the toes still and relaxed. So that's something that you might want to do on the daily, a couple of times a day, 10 to 20 repetitions of those throughout the day to help bring that toe and strengthen those intrinsic muscles that bring that toe back in line. Some other exercises you might like to do is stretching of that big toe. We need that movement for walking, for running, for going up and down stairs. We need this movement. We might get stiff joints. Our joints might be affected by arthritis. So we want to ensure that we get that. Now you can stretch it out with a wall, or you can passively move it yourself. If you don't have a wall, you can use a rolled up towel, pop your toe on the rolled up towel, obviously creating a bit of height there. And then you can either hold the stretch or even add pressure to the stretch by doing calf raises. For strengthening of the anterior lower leg muscles, we can do some dorsiflexion exercises. And if you get plantar fasciitis or pain under your foot, you can also get a similar, like a bolster, perhaps a bit smaller, perhaps a bit harder, or some sort of trigger point ball, and you can, like a tennis ball is fine, and you can roll over that as well, forward and back and side to side on it. And these are the mobilization exercises that I might take you through now. So what we want to do is, again, the foot needs to be adaptable and it needs to be able to move. So what we're going to do here is just go through some mobilization techniques that you can do on yourself to help promote that movement. So what I'm going to do is I'm going to stop the share and bring us back here. Yes, don't worry. These slides, okay, I can make these slides available. Sorry, I'm just reading a comment that someone's like, oh, I won't remember all these. One, this is recorded, so you can watch it back and stop it. Two, all of these exercises, except for the toe exercises, are resources on our website. They're free. They're sitting on there. It's a booklet and there are videos that accompany it. Okay. So you can certainly go. I'll put the link in there shortly. So we've got about 10 minutes left. So what I'm going to do is I'm going to take you through those exercises now. You need to bear with me as I just position the camera so you can see. And what you might like to do is try to change it so it's just on presenter view, so you're not trying to see me among everybody else. And I'm just going to bring up those toe exercises here so I can see which ones they are. Here we go. Okay. So I'm just going to sit up on my couch here and move that gently. Bring you closer. Okay. So for all those people with ankle and foot, this is good for you. Now, in saying that, mobility issues at the hip can indirectly affect the way that we move our knee and our ankle. So even if you may not have arthritis of the hip or the ankle, these are going to help you regardless. If I don't have full range of motion of my hip, then the way that I move through my gait, running and walking and stair climbing, is going to potentially change the way I move my knee or my ankle, and vice versa. I may not have full toe range of motion as I walk, which means that I might not use my knee with full range of motion, or I might overextend it when I walk, and the same with my hip. So there can be indirect effects, and they may stack up over time. So there was a knee exercise that I thought I might just quickly show you here. So this one here, this one is really good for extension, remember? So you want to roll up a towel underneath your knee, and I want to use my quadriceps here. So I'm going to squeeze them on as I push down into the towel, okay? And you can see my ankle coming off the ground or off my couch right now. So this is really good for if you are sedentary or you have a sore knee at that moment. You might not necessarily be sedentary. You might be quite fit and get around quite often, but you might have a sore knee at this particular time. So this exercise is good for that. You're not putting a lot of load and pressure on it because I'm seated, okay? But I'm still getting some exercise and some muscle contraction through my quadriceps, which is important to maintain. I am getting some movement through the joint, which is also very good for movement of synovial fluid. And this is a movement that I must keep as I age, so I can do my functional activities, walking, standing, sitting, okay? So then looking at the toe, we want to make sure that we keep range of motion of this toe, okay? I have probably the most ugliest feet going around. Do apologize. I know you're not looking at them in that way, but just have to say that. So when you're walking toe off stage, this action needs to occur to allow proper functional walking gait. If you don't have it, you might find that you shuffle a little bit, or the steps that you take are quite short or closer together, okay? And that goes the same with our other toes as well, but the big toe is the main player here. So if you have trouble with movement of this toe, what you might like to do is grasp the bottom of your foot, okay, before the big toe, like so, with your hand over the toe itself, where that main big joint is, and all you're going to do is gently lever that over your thumb, okay? So this thumb is pushing downwards on a diagonal, and I'm just levering gently the big toe over that thumb, okay? So remember, we want to maintain that motion, okay? Remember, you don't want to push so that it is excruciatingly painful, but you want to push into a little bit of discomfort.
That's it. I'll see it visually, but not no, it's all right. I can see it visually.
So that's that exercise there.
Oh, the same. I haven't really my father.
Now, if you want to move the metatarsals, so these long bones here, okay, they're important to get moving as well. All you're going to do is place your hands on top of your foot, feel those long bones that come up from your toes towards the top of your ankle. And I'm going to use my thumbs like this, and I'm just going to gently move up and down like this. Okay, so I place them here, and I'm just going to move them up and down like this. Okay, and I'm going to move my way out towards the long bone, where the last long bone, should I say, where the pinky toe is. I know that is difficult to see. Camera needs to be facing down, but I'm my own cameraman today. So that's that exercise there. And we also need to have adaptability in our foot, remember? So we need to be able to move it up and down. We need the big toe to move as well. We also need to be able to move inversion and eversion. So to do that, to do a couple of those exercises, what you want to do is grasp your calcaneus, which is this big bone at the back. So that's your heel bone. You want to grasp that sitting on your leg. You can rest it on your leg. I just need to hold mine up for the camera. Okay. And I can hold and stabilize the top part of my foot, whichever way I feel comfortable. And all you're going to do is move it up and down. You want to take your foot through this range of motion like this, like you're tilting it. If you're on a boat and you're rocking back and forth, that's what you want to achieve. Okay. And remember, even if you don't have arthritis problems in your foot, we still need to have mobility of the foot. It will help any knee or hip issues if we maintain range of motion of our foot. The last one is we want to grasp our foot in the middle, almost like a Chinese burn, if you will. And we want to create this motion here. And again, I'm just doing a ringing motion like this. Okay. And again, that helps promote the mobility of the foot and the bones and the joints that they all create. And again, because the foot needs to be so adaptable as we're using it. When it hits the ground, when it impacts, it needs to adapt. And we need to promote that motion. So we can do that passively. Is that as good as doing active exercises? No, it's not, but it will help if we start to do these things over time and increasing frequency of them. So that was that one there. Oh, and I'll see if I can just show you this one here. This was moving the big toe. So if you have a look at my feet here, do you see how my big toe is off on an angle? Do you see that? So I'm 35 and I have this, but I know my mother, it might be genetics related. My mother has this as well, but I know that I have quite a broad foot, and I know that all my years, I've always shoved my feet into these tiny little shoes, thinking that I was a size 6, always with my feet. And they were quite narrow. But then again, I'm 35, I've had kids. And I don't know about you, but during COVID, a lot of people weren't wearing their little pointy little shoes anymore, or their high heels. They were, walking around in slippers or no shoes at all. And I don't know about you, but I certainly found that my shoes that I wore before COVID, if you will, were feeling a little bit tight on me. And I thought, oh, what happened there? But a lot of people, because our feet are so adaptable, those bones have actually started to spread out again. So very, very interesting. But if you're like me and you have an issue here, and I don't have arthritis in my foot, but I know it's going to be helpful for up the chain, my knee and my hip. I know that if I can try to do exercises to fix this toe here, in the future, I'll reduce maybe any bunion. Well, it's sort of already happening, but I reduce the severity of it and how quickly it might come on. So what you want to do is on the floor, this is me on the floor, but put your ruler down or a marker down on the floor and see how my toe is off on that angle. I want to try to move my toe towards the ruler or the tape on the floor. It's a bit difficult doing it without being on the floor, but trying to keep your toes, the rest of your 4 toes, as still as possible. And you're trying to work the muscles and encourage the movement in the joint to make the bone, or should I say the muscle, strong to keep the toe, I guess, without deviating. You want to make it straighter again. So that exercise can really help for anybody, for any bunion related issues or any arthritis related issues. Okay, that's 11:31. Like I mentioned before, those exercises are from the Get Moving. I'm going to dump give me one moment and I will pop the URL in here. Get Moving Plus. And it has, like I mentioned, it has videos for you to watch yourself. And it has the resource that you can download as well. So what I'm going to do here, meeting. So I've just popped it into the chat box. Excuse me. And if you go to that website, you can see that I've got the program. The program has been endorsed by 2 physiotherapists, one from the Canterbury Hospital, one from the Royal North Shore. One is a lower limb based physio, the other one is a hand physio. And so those resources have been endorsed by them, been reviewed by them. And so so that you're in good hands when you look at those resources and download the PDF. You might have to click on the PDF icon, for the particular joint for it to pop up. You can print it off and have it with you. It gives you a whole preamble about making sure that you're safe in your exercise environment. How many repetitions do I do? What is a repetition, and what those exercises are used for? Is it exhaustive? Absolutely not. It could have way more exercises in it, and we plan to sort of upgrade that as we go on as well. So I'd love you to have a look at it, check it out and see if you like it. Have a look at the videos as well, see if you like it and provide any feedback. Now, before we do go, I know there is a lot of us here today. Does anybody have any questions? I'm a bit scared asking that because we might have many, but I'm really happy to try and answer as many as I can. And remember, this is recorded. You can come back to it. If you'd like the slides, I will happily give them to you. Email me. I don't know if we can put them up on our online, but kkeene@arthritisnsw.org.au. I'll just put my email up here. Oh, hang on, sorry. Just need to send it to everybody. If you'd like them, I can send them to you. I'm more than happy to send them to you. kkeene@arthritisnsw.org.au. Yes, more than happy to send them to you if that's what you would like, if you prefer that. If you have to leave now, that's fine. And yes, are there any questions that you may like to ask right now before we leave?
Hi, Kat. Helena.
Hi, Helena.
I just want to verify what you've said about the bunion. My girlfriend used to have a relatively big bunion that she had to get a size large in the shoes, but
Yes.
she went somewhere, she did some of the exercises and some massaging as you were showing too.
Yes.
And her bunion is pretty much gone. She doesn't have to get a separate shoes. So just for everybody.
It can happen, can't it? Yes. Thank you for sharing. They can be so painful, and the movement of it can be painful, and it deters a lot of people. And that's a wonderful story to hear, that a little bit of work, a little bit of exercise and persistence, and repetition of those exercises can really help. Look, and of course, and these are all conservative ways to manage this kind of stuff. In the end, it may get to a point where you may need surgery. And there are also lots of splints that you can use as well, and just looking at different types of shoes. Excuse me. But thank you for sharing. That's
it did take persistence and it did take time. So I'll just add to that too. So what you've said is spot on.
Correct. Yeah, thank you so much for sharing. That's really great.
It's very informative. It has helped. Will you be talking about the sciatic nerve at any time? I have a problem with my sciatic nerve in L4 and L5.
Oh, that's look, I hadn't planned on it, but I'm sorry, excuse me. It's been an hour of me talking in this cough. I do apologize. There are some good nerve slider exercises that you can do. It might be better that you email me and I can flick you some, because I don't know how relevant it might be to put into the presentation in a fortnight's time. So you're welcome to email me and I can give you some.
Cool. Thank you very much. You have a nice day.
Thank you. Bye-bye. You too.
Hi, Kat. It's Jules. Thank you for a fantastic session. Just a question, the recording of this session, yes, does that automatically get emailed to us, or do we need to go somewhere?
Good question. I don't do the emailing, so I don't know, but they're all kept on our website. So they all end up.
Okay.
Yep. Yeah. So if you just search in the community webinars, there'll be a link there for recording webinars, or if you just search recorded webinars on our website, it'll pop up. I'm not sure if the link is sent in an email that follows this up, but it is on our website.
Fantastic. And it was so good. So thank you so much.
Oh, thank you. I do wish it was a little bit more practical, so I do apologize for that, but a lot of the videos are online. So I wanted to bring your awareness to this. And if we like this and we want it more practical, happy to do so, but I'd love to hear your feedback. So fill out the Survey Monkey when it comes around, or email me. Happy to have your emails as well for feedback, okay? I think I just answered that. Okay, great. Well, I think we'll leave it there, everybody. If you have any other questions, burning questions, into specific, like about that sciatic nerve, happy to. I'm a musculoskeletal therapist as well, so I can certainly give you some ideas about what might help. Okay, I don't know you and your situation personally, so I will just provide you with ideas that may help you, that you try. Maybe you take them to your physiotherapist or somebody else, and they say yes, no, maybe. Okay. All right, guys, thank you so much for coming along today. I've loved seeing you all here. I hope that it is helpful, or some of it has been helpful for you. And next, or in a fortnight's time, we're doing the upper limb, like I said. So hand, shoulder, and spine. Okay?
Thank you, Kat. That's great.
All right. Take care, everybody. We'll see you then.
Thank you.
Thanks, Kat. Take care.
Bye.
Bye.
Bye.